So, good morning, respected T. Ravinder Reddy, CEO of International Institute of Quality Accreditation, Hyderabad, and all the doctors community of various medical and dental colleges, and also my dear students. And we have a guest speaker today for webinar this month. The importance of recently I went attended a NMC meeting at New Delhi last month, where the ranking of the medical colleges and grading of the medical colleges are very, very important. So until unless you all people work together to improve the standards of the medical education only, the university rank also will improve. So we had a eminent speaker, T. Ravinder Reddy, who is an authority on this NAAC and NIRF, and he will start the topic on the both the things. I request Director of Publication and also in charge, research in charge, Dr. Sudha, MDS. She will read the biodata of Ravinder Reddy garu. Thank you.
Thank you, sir. Honorable Vice-Chancellor, sir. Today's speaker, Dr. T. Ravinder Reddy garu, CEO, International Institute of Quality Accreditation, Hyderabad. All the principals of the government medical colleges and dental colleges, and all the faculty members, a warm welcome to the today's WebEx meeting on NIRF ranking and NAAC accreditation. I would like to introduce, it's my pleasure and honor to introduce Dr. Ravindra Reddy garu. Sir is national awardee. He received award from President of India for Excellency Sri K.R. Narayanan, former President of India. President of awardee he received and sir is very expertise in NBA accreditation, NAAC accreditation, and ABET accreditation, global services, AICTE, and sir is advisory for visiting professor in University of Pacific, California, and sir is an expert resource person and professor of practice in national level of HEIAEC. Sir is a resource person national and internationally. And a key advisory collaboration experience with eminent professor in administrative experts. Sir is a legal advisor for HEI establishment and accreditation. And sir is also a quality education inspirer for Dr. E.V. Ramana Reddy IAS, former IT secretary, and also a HEI accreditation experts in Professor K. Subramaniam, IIT Delhi, Professor of Krishna Rao, former director of NIT Warangal. So he is a best resource person for NIRF ranking and NAAC accreditation. We warm welcome you, sir, for the session, and thank you for coming all over from here and spending your time with us. I would like to, I'm very thankful to introduce you, sir. Thank you. Over to Dr. Ravinder Reddy.
Good morning to.
Sir, question.
Good morning to Honorable Vice-Chancellor and all professors of NTR Health University and the colleges affiliated chairman, secretaries and principals, deans of medical colleges and hospitals. Today, I would like to give two sessions. One is NIRF and other one is the NAAC MBGL. In NIRF, as sir has told rightly, the medical colleges ranking, if you observe in Andhra Pradesh, last time also, the government of Andhra Pradesh has tried for some medical colleges ranking in Telangana Osmania Medical College has got rank, and AMS and PGI and like this JSS has got NIRF ranking. I have been associated with the NIRF ranking since the inception of the NIRF ranking. So in the NIRF ranking, if you see the limited to 5 criteria, NIRF ranking, coming to this, these are all my slides where I have given lectures. In the NIRF, data capturing system is very important. NIRF. First, you have to register NIRF of your institution in the official website of NIRF. NIRF head office is there in New Delhi. It's just side by to the NBA office in Bhishma Pitama Marg. And you have to register first your institution with the NIRF. Then afterwards, they open the access for the application form for the institute. NIRF ranking can be applied by any regulatory council authority recognized college, medical, engineering, agriculture, pharmacy, and law, and universities. In the universities, different disciplines, if you have, you can apply individual disciplines, and you can apply overall university also. The ratings, for example, if you take Andhra University overall ranking is there, Andhra University Engineering College ranking is there, Andhra University Law College ranking is there. Like this, faculties can apply individually. So in the NIRF ranking, there will be a data capturing system in 5 criteria. Application form will be there. In the application form, you have to fill up the columns based on the data that you are submitting. The evaluation will be done. There will be no visit for the NIRF the recognition or ranking. Only on the basis of the data that you are submitting, you will have the ranking system. So these are the 5 criteria in NIRF ranking: teaching, learning, resources, research and professional practice, graduation outcome, and outreach and inclusivity and perception. See, any institute, if you take in the NIRF ranking, TLR, those who have got maximum marks, they are getting the ranking in the medical colleges, engineering colleges, and overall universities. Teaching, learning, and resources. And next one is research. If you take the teaching, learning, and resources, you have first is the student strength. See, admissions, student strength means generally in medical colleges, 100% admissions will be there in UG, MBBS, and the admissions have got some marks. PG admissions have got marks, and PhD admissions have got marks. So now the admission part, if you fill up for the 3 academic years, one is suppose now you are applying in 25-26, you have to give the previous 3 years data, not this year data. So the admissions that were there in the last year, you have to fill up into it. Last before year already, if you are applying for the first time, 3 years data at a time you have to give. Suppose for example, you have already participated in last and last before year and last before 4 year and last year, then freshly you have to give 1 year data. See, most of the questions in the NIRF application form, whatever are there, all will be of 3 years average data. So the data is calculated based on the average of 3 years. You will have awarding of the marks. Suppose for the first time you are applying, you have a choice to enter the data. Suppose for example, already you have participated, now you would like to change the data that you have submitted already. It's not possible. The edit mode will not be given to the earlier data that you have given. So for the first time you are applying, you have a choice. For already applied, you cannot go for that. And basically, NIRF is a transparent awarding of the ranking system, and they have started this year the negative marking also in research publications, especially data that is there, you have to display all this application form in the your college website, and this website application form should be visible to the public domain. There should not be any password to it. If you give password to it, they will give an email, and you have to remove the password to the website. It should be open for all. And another thing is that the student admissions, 20 marks are there, and those who have got, for example, if you take medical colleges don't have authority to go for the, that is PhD, but DM is there. DM is equivalent to PhD. And some of the medical colleges, they have got direct PhD admissions. In case of Andhra Pradesh, how it will be, you can have authority to give the advertisement for issue of the PhD notifications in biochemistry, pharmacology, like this, you can enter the admissions. And next one is the faculty student ratio. What do you mean by faculty student ratio? Means the faculty are very important for the NIRF ranking. I will explain the application form also, but now beginning, faculty generally in medicine, it will be 1:10 ratio will be there. For PG, it will be different based on the cadre ratio, 1:1:2, like this. And different courses, they have got different student faculty ratio. If a student faculty ratio in accordance with the NMC, National Medical Council, all rules and regulations and data will be in accordance with the guidelines of the NMC only for the medical colleges. Suppose, for example, it is a law, it is a bar council. Suppose if it is a agriculture, it is ICAR. So like this, every regulatory authority will have, suppose it is dental colleges, Dental Council of India. So coming to this, the faculty ratio, and another one is the faculty experience is also one of the question. So in the faculty experience, less than 8 years and more than 8 years to 15 years, and 15 years above faculty, 1:1 or 3:3:4 ratio you should have for getting a full marks in the case of experience, faculty experience. And faculty with PhD. So actually, NIRF is asking very high benchmarking of the PhDs. They are asking 95% of faculty with the PhD. It is a little bit high. And NAAC is asking 70%, NBA is asking 20%, but faculty. But NIRF ranking is, because the NIRF ranking has started with a motto to have QS world ranking, all that. And in the world rating, since we don't have, in 2016 NIRF ranking started, and most of the US universities, if you see, their PhDs, all faculty will be PhD. So with that concept, so the 95% of the faculty, if you have full marks, it is not that if you want to have, if you have 50% of the faculty with PhD, you will get the marks, but marks number that you are getting will be less. In case of 40%, in case of 50%, in case of 60%, there will be a scale for that. Based on that, you will be getting the marks to that question. And other one is the financial resources and utilization. See, all three, student strength, faculty student ratio, faculty experience, faculty with PhD, all these will be 3 years data. See, coming to this, the financial resource and utilization. See, financial resources means two types will be there. One is the capital that you are investing on the buildings and infrastructure, and other one is the recurring that you are the keeping on the salaries as well as the operational expenses. All these will come in this the expenditure. So here there is a formula: 7.5 into capital and 22.5 into operational. If you have operational expenditure very high, and that is 3 times, and if you have the capital expenditure around student, the per student expenditure should be in lakhs. You should have in AMS and in JIPMER and in PGI, the expenditure will be in the capital will be in crores, and in that part also I'll show you in the slide. And in the operational also, the salaries are very high. So this is a comparative evaluation of the NRF factor will be there, and the top expenditure which is having that institute will be number 1. say percentile point of view. So the listing of the expenditures will be there, capital as well as the the operational expenditure. And for this, the evidence that you have to submit is that, see, the audit reports of 3 years. And for student strength, NMC approval letter and university affiliation letter. For faculty student ratio, this faculty that you are submitting to NMC and all that, the authentication, and you have to keep your faculty in your website. And in that one, PhD, doctor, PhD who are there. And you need not to upload any of this detail except a few. That is most of the data, it will not be like NAAC, every criteria. So specifically what they give the data capture that you have to give. So this is about the online education. Next one, online education means you should have some facilities for the online education. And nowadays, most of the digitalization has come. See, the ICT as well as the AI-based personalized learning and the Diksha, Swayam portal, Swayam tutorials, NPTEL videos, so many things have come up. And the Moodle, MOOC, so many have come up. See, multiple exit, multiple entry, Indian knowledge system, and regional languages in this one. Actually, the syllabus for the engineering and universities are different, and medical colleges syllabus is different. It is syllabus is framed by the regulatory authority most of the cases, and you have to follow the NMC guidelines. And this is compact based the system will be there, and the multiple entry, multiple exit, where the regulation will be prepared based on the 7 years. It will be there, and the student after completion of first year, if he wants to leave, he will be given certificate, and second year he will be given diploma like that. But in case of medical, it will be different. And this is about the first criteria. So 100 marks will be there. If you score maximum in this, there will be a possibility for the ranking. And next one is the graduate outcome. I will take up individual application forms. See, a lot of applications have come up. For medical, you can see 223 applications have come up. For dental, 223 applications have come up in 2025. And India rankings, engineering, pharmacy, and medical, you can see some of the data. And overall universities, can see faculty with PhD, how many are there? Some data I have collected. I am sharing with you actually. So this is a useful information to you. Means you should also apply, participate in the ranking like that. I have shown this many of the this form. Now I am explaining to you the weightage 100 marks. 30% weightage will be taken up, and research and professional practice 30% weightage will be taken up. Among the marks that you have scored for your institute, 30% weightage will be contributed for the research professional, and graduate outcome 20%, and outreach inclusivity 10%, perception 10%. So now this application form, just now we have discussed this, and individual also you can see the A, B, C, D. This I have explained it to you, and the research and professional practice. What is my idea is for research and professional practice, you should have Vidwan ID for all your faculty. See, IRNS, Vidwan ID, and Google Scholar, and ResearchGate, and Web of Science publications, and citation index, all this, and the publications, and for this, in your website only, this second criteria, total research and professional practice, will be assessed by the third party in the NIRF. See, this many applications have been received by the NIRF. How they will evaluate means, the system evaluate is this through software they are evaluating it, and evaluators will be there. After getting of the software outcome, the evaluators manually will go through into your application form, and some of the criteria they verify and sample randomly, because of the number of set of applications are very high. So the evaluation will be mostly in the number that you are giving in your application form, and corresponding evidence they verify from the website also. For example, you are running some courses. So PG course you have entered, but in your website PG course is not listed. Then they will give a query to you. Suppose in your website you say that you are offering some DM course so and so. but in application form you have not entered it. So clarifications will be asked by the NIRF time to time. Basically, the research publications what you have got, the indexed journals are very, very important, and H-index, and as I have told you, citations and quality publications, Q1, Q2, Q3, Q4 journals, and the publications that you are having as a bibliography is also one of this. And the your publication is if it is being listed in some others as a reference, that will be also carries the citations. And other one is the footprint projects and professional practice. In this one, grants, especially the AIMS if you take, and PJ if you take. And PJ, they don't have a bachelor degree, and they have got crores of rupees grants. And the grants also, comparative evaluation rating will be there, NRF factor will be there. The marks which are allocated, 20 marks for that. In that one, the where you are there among the applied application forms, your the fraction value will be given into that, multiplied with that the 20 marks that you have got in the grants. See, grants sanctioned by the government agencies like ICMR, DST, DBT, and UGC, and other the Tata Fundamental Research, and other renowned organizations, and other outside world also, some of the organizations. And your consultancy work is also having a lot stake, especially in clinical point of view. And whatever the revenue that you are earning in your hospital will be a big boon in ranking of your this thing. Suppose if you take the All India Medical Sciences, their OP and their the inpatient number and bed occupancy ratio is very high. Their revenue is also very high. I will show their application form. I have got their application form also downloaded from their website. I'll show that also. See, in the grants, not only this, you should have the IPRs, intellectual property rights, that is in the IPRs published and applied and they licensed. Those IPRs which have got revenue, that is which have got the earnings, those have got more marks than simple published, simple, that is the applied. So once if you have revenue over it, those will be calculated more in the NIRF ranking. Basically, if you give the paid journals, and if you give the some other journal publications in the filtration, automatically only the quality publications they rate and they give the marks for that. So this is about the professional practice, and when you do it, some of the grants that you are getting for establishment of some of the research centers, all these will also calculated into it. And next one is the graduate outcome. Graduate outcome, generally the results pass percentage will be there in the graduate outcome, and the placements and higher studies. This is a problem with the medical colleges about the placements. Suppose engineering college is there, you can have placements, n number of companies will come and just see. It is a practice of profession. See, whatever you are doing is the most of the government jobs and all that. See, the placement part, you have to list with the offer letters. See, the placement will be verified through a next step after application form that you applied. They give the clarification email to you, and you have to give the offer letters and meeting that data that you have kept in the application form. Not only placements, average placements, that is see, you have got some in the MBBS, you have got some 250 students. So 250 students, in that one you got the, suppose 100 students got the jobs in the final year completion. So it is not calculated on the basis of the final year strength who have written the examination. It is calculated as a denominator for the first year into MBBS, how many students have admitted into it. So denominator is the admission, that is sanction intake. Strictly speaking, sanction intake will be the denominator, and the placement number, that placement offers that you have got, is the numerator. So With that, you will get the percentage of placements and average placement. For example, if you take AMS, average placement will be the 30 lakhs, 32 lakhs, like that. And among the placements candidates of that is the package, the middle one and best of two of the middle, if you take and average of it will be the placement average. Placement average has got marks, percentage of placements have got, quality placements have got marks, and university examination 80% above if you have got result, then based on the admitted students you will have the full marks for that. And metric number of PG students graduated in the PG, 2 years PG will be there, 3 years PG will be there in this, and DM will be there. Based on that, in the application form, what is the entry year, and the following graduates in that year, how many have appeared exam, how many passed, and how many joined basically on this. And in this, the PhD admissions what you made, and the MBBS admissions what you made in the beginning year of the course, and the PG how many admissions you have made, and MD, DM, MS, MCH, DNB, whatever the admissions that you have made in the year. Based on that, the results pass percentage, placements, and package, and quality placements, and the examination result will be different. And this will be automatically, if you enter the data, the software will calculate the marks for you. And in the PhD, you have got 20 marks for PhD graduate outcome, 5 marks for PhD admissions. Those who didn't have PhD or DM in their college, so they lose those 25 marks. That is DM equivalent to PhD. And based on that, suppose you don't have PG, you lose marks for the PG. Only only if you are running the UG course MBBS, you lose the marks for that. The application form is designed in such a way that it is a common application form, and if you don't have PhD, you will not be that marks will not be calculated in the denominator. It's not like that. So though you have the course or not, the marks will be calculated, the courses will be calculated into it. And these are about the graduate outcomes. Higher education through NEET, how many students have got the that is PG courses, and the PG students have got DM courses. All these will be also having marks. And next one is you have the that is outreach and inclusivity. See, what do you mean by outreach and inclusivity? Means the out of state students, how many you are studying, out of country students, how many you are studying, and these students, this shows the cross the education, and this is student diversity. We can say that in this one, you have got students from other states, countries. This is a regional diversity. Generally, the standard college, the standard of the institution will be one of the criteria is if more number of faculty are working in the institute from the other states and other countries, and more number of students are from the especially this question is for students, and the students are joining into this means the open merit students are more in that. So the marks will be based on the number, marks will be calculated. Suppose Telangana student is studying in Andhra student is studying in Telangana, he will be called as the out of state student, and other states also. And this is for 1 year data. So thing is that if you take up the student strength, faculty student ratio, and the PhDs and financial, these 3 years data. But coming to the inclusivity, is the 1 year data. See, this year, what is the data that you are giving will help in the ranking of the your institution. Previous 2 years data will not be taken into account while calculating of this data. And the other one is the physical percentage of women diversity. See, there are two parameters. One is women faculty, 30%, women students, 50% of the sanction intake. If you have got, you will be getting full marks. So for women's colleges, it is a big boon. For other colleges, if women students are generally in medical, women students will be there. So this is an added advantage for you. 60%, sir. 60%. Then the other one is the economically, socially challenged students. This is actually government is giving scholarship, and institute scholarships will be also given, and scholarships number which are not getting any scholarship. Maximum if private scholarships and institute is giving scholarships, you will get full marks. So this is about the economically backward students government is giving socially, and the other one is the facilities for physically challenged students. This generally as per NMC norms, most of the colleges will have, every college is schooling full marks. So the last one is the perception. Perception means the 10% of weightage, outreach also 10% of weightage, 100 marks, 10% weightage. Perception means first perception depends upon the brand value, and your graduates, how they are in service motto of medicine, surgery, and societal, how they are in the country and in the state and in the local region. So this will be rated through your different aspects, like the international exams, how many USML and the NEET and the other the placements and average placements and faculty research publications and faculty outstanding as the members in the regulatory councils like NMC, like NABH, NABL, and other state executive councils, and advisor to the government of India, government of Andhra Pradesh, like this. The perception will be, application will be sent through MHRD to the professors, to the hospitals, super specialty hospitals, and rating will be given by them, and they will ask us, our stakeholders, and generally from those stakeholders, 50% of the to them they send, and remaining 50% they take from website, they take from regulatory council and other rankings of you, NAAC, and the NABH, NABL, and your the other the hospitals reputation, and all that will be taken into account for the peer perception. See, this is about the application form, sir. Now coming to the NIRF application form, if you see this, the sanctioned intake, approved intake, placements, graduate outcomes, and program details, MD, MS, and capital expenditure, library, labs, capital assets, sponsored research, projects, agencies funded, student strength, PhD students, super specialty. These are all I have covered. See, OPD and bed occupancy and faculty details. And category 1. See, this is the programs, this already I have discussed, and example approved intake data, how application will be filled up for 3 years. You can see this, I have put 4th year also, just for explanation sake. Gender breakdown, fee reimbursement, example student strength, placement and higher studies, median salary also I have explained, and placement and higher studies I have explained, and PG students, super specialty programs, equipments, financial resources, funding agencies. NIRF mainly evaluates what? Student strength, academic programs, placement, and super specialty outcomes, research funding, financial investment, clinical exposure, infrastructure. See, quick reference summary, what I have explained so far, you can see year-wise. Sanction intake, student strength, placements, PhDs, and PG programs, super specialty details, capital expenditure, operations expense for sponsored research, the outpatient department and bed occupancy, PCS facilities, faculty details. This is the application form. Dental form is also same, almost. Approved intake for UG BDS 100, PG 3 years, 54. PhD students, financial resources, how the library will be there. See, library equipment, and capital assets, and salaries, maintenance, seminars, workshops, operational, sponsored research. This is about the average OPD in a year, how many, that is the outpatient you are admitting, and they are taking the medication from treatment from you, and PCS. See, some of the comparison I have given you. You can see this. In this, I have taken up AMS New Delhi and PGI, the Chandigarh, and Osmania Medical College. 3 colleges I have taken, and the criteria questions I have taken, and TLR weightage 30%. Just now we have discussed. AMS New Delhi has got 97.3 marks. See, rank contributing marks are 97.3. 30% of it will be taken up for calculation of rank. And PGI MER 91.5. Osmania Medical College 72.5. What is there in it? It is student admissions. That is UG, PG, PhD, or DM, or MS, MCH. So like this. And you have the faculty student ratio, and you have the faculty experience, and you have the faculty, that is the PhDs, and you have the faculty different types of the cadre ratios, and contributing this, and in the TLR financial resources, FRU. FRU is majorly top colleges are having lot of expenditure, salaries, and all that. So they are getting rank, means in MBBS, in medical colleges, they are considering only 50 applications for ranking. For engineering, they are considering 300 application forms. For pharmacy, they are around 100 to 1. They are considering. But medical, so demand is there to go for beyond 50 also. The awareness has come in the medical colleges, and state governments also so encouraging the medical colleges to apply for the NIRF ranking, because in the globally, when our student goes to there, if you have some ranking, some accreditation, some quality assurance, your syllabus and all that will have a different stake. So that's why the NIRF ranking is one of the boosting this thing. And this one, research 30%, 94.5, 94.8 AMS, 79.9 Chandigarh, and Osmania 32. Research is very less, you can see, compared to these 2 institutes, because these are all research centers, sir. I have seen All India Institute of Medical Sciences, and some of the professors might have studied in that college, Ansari Nagar, and this PJ is also, their research is excellent research they have got. Osmania also having research. So basically, many people think that since we don't have research, we can't get rank. It is not like that. If you see the scale, 32 means minimum only they got, but they are good in the other TLR, they are good in graduate outcome, they are good in the outreach, inclusivity, and perception point of view, they have got only 35%. But whereas the AMS is having 100%. If you see this, see, if you apply, you will come to know where you are, and what is the gap that you have, how you can cope up that gap. You can plan accordingly, and the gap analysis will help you to improve the standards and quality argumentation. So this is the most important one. And weighted average score, see this 1.30 into TLR, 0.30 into, this is an equation simply. And if you take up this, AMS has got 95.36 marks, 81.46 PG AMR and 53.8. In medical colleges, JSS Medical College Mysore has got rank, and the Ramaya Medical College also got rank, and in the dental Savita and the JSS, like that, some of the colleges have got AMS also. See, the rank depends upon the data that you are submitting to the in your application form to the NIRF. If you have faculty number, that is more number of PhDs, you will get more marks. If you have got satisfying student faculty ratio, you will get more. If your capital expenditure is high, and if your operational expenditures, you are paying very good salaries, you will, like this. It is a comparative evaluation, 1-to-1, 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 like that. Overall, and year to year, you can improve by looking into the application form. Based on that, see the OPD ratio and bed occupancy ratio, teaching and the syllabus that you are teaching is improvements and digitalization. All these, where you are lagging, you can study the application form, and you can have this 53.8 Osmania Medical College. Lot of difference in 95.36 and 81.46, 53.8. See, if you score this
minimum grading, sir.
Sir,
minimum grading.
Actually, 50 up to.
Okay.
To 50. So among the colleges applied, 50th college where it is touching in merit, so they give the ranking. And Chandigarh College and AMS, all AMS, they didn't get the ranks. AMS New Delhi, Ansari Nagar has got the rank. And their Hyderabad AMS, they didn't get, and Patna AMS, they didn't get. Only New Delhi AMS, because of its various funding is also very high in that. I've seen the college, and it's a excellent. And the facilities, very good facilities are there. Equipment is there, radiation and all that. See, government of India is giving a lot of funding to it apart from Delhi. So it's a centralized institute. So
the central institutes, what I came to know recently, last December, I visited All India Institute of Medical Sciences. Their budget is 5,000 crores in a year.
Sir.
So leave alone the colleges. Now the medical college, we got 38 medical colleges. Out of 38 medical colleges, 17 government and 19 private medical colleges. So definitely there is a improvement in the infrastructure. We got manpower wise, I think we got almost 40 to 10,000 students. Undergraduates will be around 6 to 7,000, and 4,000 to 5,000 postgraduates are also there. So nursing, and if you all take 570 colleges under the university, so almost 50,000 students every year we are getting admitted. So around 2 lakh patients, 2 lakh students are there in the entire university we have. So it is a time that I think we should start NIRF and NAAC ranking. So I request all the principals and also the administrators to start doing this one. See, like Usmania Medical College, they got a 53%. So let us do a beginning, and our Honorable Health Minister and Chief Minister and Health Minister, and also the Secretary Saurabh Gaur, they're asking us to improve the ranking. Particularly when I visited the recently 1 month back NMC meeting, grading of the medical colleges and also ranking of the medical colleges are very, very important. So that's why we called Ravinder Reddy. I think this is the session on NIRF. Then we'll go to the NAAC. Before going to NAAC, so I request the professors concerned and also the principals, they come out and clarify some of the doubts for 10 to 15 minutes. Thank you.
Right, Chair. You are talking
You
about
can ask any doubts with regard to NIRF ranking to medical colleges. I have experience in guiding the NIRF for
Excuse me.
medical colleges.
Good morning, sir. From Guntur Medical College, sir.
Madam,
From Guntur Medical College. Sir, you are talking about taking some ID, Vidwan ID or
Yeah,
some book.
madam. Actually, third party is evaluating the research score, what you have
Okay.
got. Suppose, for example, in your faculty, you where when you are working in this institute, if you have affiliation to this institute only, you will have the publications in calculation. Suppose 10 years back you have worked in some other college, that they won't take third party. Suppose if you list all your publications with your Vidwan ID, you can register Vidwan ID, and into your own portal you can upload your the FDPs, seminars, workshops, and citations, books, and publications, and all that. Likewise, institute is maintaining the Google Scholar, and institute is maintaining the research gate. Institute is maintaining the faculty Vidwan ID. It will be easy for the third party, once if they put your college name in search, automatically it will go to your website, because they are using AI. Immediately it will go to the your college website, and if you have all the faculty Vidwan IDs listed in Google Scholar, ResearchGate, and all that in your college website with research IDs, so automatically no publication will not be unlisted. So in your calculation, so that is what
So
we have been doing it in engineering and other universities, and this is what.
our institute should take the ID or individual faculty.
Individual can register with one ID is individual register, and your ID you have to give to the dean R&D, and he will
Okay.
list it all faculties in the college website.
Okay, sir.
Suppose, for
Thank you.
example, if you take up Andhra University, see, computer applications and IT department is there. So under that computer applications and IT department, CA North Campus, if you take this, and all the faculty with one IDs, you and madams and SARS photos, you can see at a time. The third party can view it very easily. Otherwise, if you put his name, some of your publications will reflect on your own name, some will be reflected on the college earlier that you have worked, some will be here. So it is the person contribution that you are working with this institution means earlier your expertization in research will be also useful. So that's why we maintain a record of it in the Vidwan ID and IRNS. So anybody can register. This is option is there, and if you your Dean R&D IQAC are taking up these drives.
For this publications, how do they grade the publications depending upon the indexing, PubMed indexing
Uh,
or
Basically, the different journals have got different the procedures they have adopted. Overall, see, the Q1, Q2, Q3 journals, Q4 journals, the Medipub, they are following your citation, how much you are getting to that. Based on that only, the content, especially content, how it is, the value of your research contribution they take into, um, especially how many have taken up your publication as a base publication for the next research scope, how it is there. And there is a
you mean
scale we calculate
citations?
also.
Citations, sir? You mean
Citations.
citation?
In the cloud, you have to keep your publication. How many are the taking your publication as a reference will be the factor.
Okay, sir. Thank you,
And
sir.
for you, individually you can calculate. Suppose one professor is there, he has got 1 lakh citations in IIT Delhi. So see, all citations will be listed to you. You can see your publications also. Based on that, quality of publication is decided.
Sir, good morning. I have a small doubt, sir. I am Dr. Lalita, Dean, GEMS Medical College, Srikakulam. I hope you can hear me, sir.
Yes, madam.
Yes, sir. So I just wanted to understand whether the competition or the ranking is among the medical colleges and engineering colleges, or it's all put together, sir. The whole, all the institutes together.
Madam, medical is a separate category. Medical colleges
Yeah, yeah.
means your application is listed with your colleague medical college only, not with the law, not with the dental. Dental is having separate, and engineering is having separate. University is having separate overall. Suppose if the university is offering medical, suppose like Gitam College is there, they have applied. So this medical alone will be taken up for rating, not the other branches of the university. But for overall ranking of Gitam University, medical will have a stake in that.
Yes. So because we have a drawback of placements like engineering colleges and all, nobody comes to us and take the people. It's like that they settle in different places for practice. So that is the drawback, I think, in all medical colleges, where we cannot give the number of placements properly as the other colleges give.
Madam,
How
for this,
to overcome?
two issues are there. First one is, I am telling you what I have come across. Faculty, contractual faculty and ad hoc faculty. You can list the 2 semesters if they work. That is one I have. Next one is placement. Placements actually professional practice. Somebody is working in some hospital. Mostly, the for 1-2 years, medical student will be go on writing the NEET exam, and they do on their own practice after registering themselves. It is a common problem with all. But see, Dean, the outreach in Andhra University and in RV College, Bangalore, I have seen that. See, every student will be in touch with the alumni cell or alumni dean, so that you can improve it. See, anything genuine, if you genuine only, we can enter in the application form, because medical college is not a small organization like a degree college. So you have to authenticate yourself, and you have to keep placements, especially um, medical hospitals. If they are working on what scale they are working, you have to collect the offer letters. That's the only thing. It is common with all. Even in Osmania also, you can see placements are very less. Osmania Medical College also.
Yes,
Madam,
sir.
actually, if you apply NIRF ranking, last year, Professor Buchibabu sir is a neuro specialist in Andhra Medical College. He called me once. I had been to there. Sir, I have seen they have got very good data. The only thing is that customizing of the data is very, very important. See, what you have, you should have awareness about that question, how to annex that the question into the appropriate window data you have to have, because it's a computer.
Yes. Yes, sir. Thank you, sir. Thank you.
In Kurnool Medical College also, last time I have visited, Andhra Medical College also. Andhra Medical College has got beautiful data. Can say that they have got very good data. Because others I have not visited, I do not know. But in Osmania I have visited, and other Telangana colleges I have visited. But in Andhra, 4-5 colleges I have visited. In that, Andhra Medical College has got data. And professors, list of professors also very good. In Kurnool to Andhra Medical College, number of professors are more in teaching faculty are almost full in Andhra Medical. I am not saying that, just with the statistics I am saying.
Thank you, sir.
Any
Thank you, sir.
medical college which are interested, I think we can take the service of Ravinder Reddy to that college. The number is with us. I think he is very, very kind enough. Actually, he was asking me for the past 6 months. So now the time has come for him. So that's why we are conducting this webinar. Definitely, these things will be. It is a beginning of the whatever this one is there. So I request you to utilize the opportunity. Start keep a person of research interest. I think already Tirupati, the principal of SU Medical College, Tirupati, they got a national rank, sir, first rank. in the research. I request the principal to say a few words.
Sir, thanks for arranging this webinar, which definitely provides very valuable inputs for applying for the NIRF ranking. We have actually, as per the request, as per the instructions of the DMA and VC sir, we have also applied for this NIRF rankings. But of course, we are about to get the results. But as sir was telling, research input has considerably increased because of this two central research supports from ICMR and Department of Health Research. One is MRU, Multidisciplinary Research Unit, mainly concentrating on non-communicable diseases. With lot of projects, we in fact stood first in the country because in terms of projects, support and then completion of the project in time. And we have also a rural project center known as multi MRHRU, Model Research Rural Health Research Center, where we are concentrating on the rural health problems. So that is also in fact, so we have could not get any ranking of that, but still I think next year we will improve on that. But it was very informative lecture given by Dr. Ravinder sir in actually helping us what points to be taken care in applying for the NIRF ranking. But the only thing is in fact some things actually are difficult for us in terms of placement. In fact, I think this NIRF ranking application tells us the importance of in fact actually making good contacts with the outgoing PGs and then UGs. institutes. Probably it requires, I think, lot of data, strong data network for actually. I think it's a long process, not a simple 1 year or 2 years process. Probably I think with the inputs given by you, and then of course encouraged by the universities. Actually, SAR is conducting so many webinars for this purpose. In fact, we are very sure that some of the medical colleges at least come to the chance of getting some ranks in the NIRF. Thank you very much, sir.
Thank you, sir. Any has got any questions on NIRF, other colleges? Vishnu, Kakinada, Rangaraya Medical College.
Patent ID గురించి patent ID గురించి మాట్లాడు.
You admit yourself.
Yes, sir.
Sir.
Thank you very much, sir, Honorable Vice-Chancellor, sir, and Ravinder Reddy garu for enlightening us on this NRF ranking, methodology and all that. The inputs are very much essential, very much useful for all the
patent ID గురించి అడుగు.
sir. And the second thing is research is emphasized. So we'll take that also into account and try to improve the quality of the publications also. So that's also emphasized. Publications, but the quality of the publications also is emphasized. Thank you very much.
Thank you. So, as you know, this academic year we have increased undergraduates 500 to 1,000 students, and almost 30,000 for 6 months, and the faculty research grant also increased to 5 lakhs for around 200 faculty members. That includes the PGs also. So I request all the principals and also the administrators on this research wing. I think they start encouraging the postgraduates, encourage the undergraduates, start doing it. I think it will take another 1 or 2 years to reach at least 50% of it. I think people like Ravinder Reddy are there. I think they will come, and if you are interested to improve your how to apply it and all, he will definitely come. I think he, in fact, has come by his own car, and we are given a. I think hardly will just felicitate with a shawl and garland. That's all. Okay, sir. So if he is very much interested, I think you can call him to the different colleges. I think we have to bear the transportation and accommodation. I think what is expecting. So thank you, sir, for encouraging this one. I think if there are no questions, we'll go for NAAC ranking.
Okay, sir. Thank you for the morning session, first session. Then we'll go for next session.
Sir, good morning, sir. Sir, Ravinder Reddy, sir.
Sir, tell me, sir.
Sir, regarding entry of patent ID, sir, to record the publication, sir.
Sir, we didn't got this patent application number, sir. That's why we didn't enter published research information, sir, in NIRF. Is it possible to enter this information now, sir?
Sir, actually, the patent, some proceeding number will be there. See, once if you apply, they give the number. Lawyers are there to apply for that. So, Chennai Patent Registration Center is one. I know 2-3 lawyers. So, if you go procedurally, you will get the number. Then only you can, the NIRF can list it.
Okay.
So, that to be licensed IPRs have got value. Just simple applied, just simple published, has got very meager marks, very little marks. See, almost 8 marks are there for that, and 2 marks are there for just published and applied.
Okay.
For licensed, something which is useful to society. You can, when you market your technology, when you market your the knowledge in the form of any device or in the form of any the medical procedures, surgical or any procedures, if you patent it, so likewise you will have.
Sir, eligible patent ID, sir.
Okay.
Right, sir. Thank you, sir.
Thanks.
Thank you, sir. Thank you, respected VC sir and Ravinder sir, for enlightening and sharing the valuable data regarding the NRF, sir. Thanks for taking such precious time and enlightening us, sir, VC sir and Ravinder sir. Thank you so much.
I think we'll go for a next talk on NAAC rank. Full screen, but Rajesh, full screen.
Sir. Good afternoon, all professors. So, National Assessment Accreditation Council, NAAC. NAAC is for institute. See, now you have, suppose one university is there, it has got law, it has got medical college, it has got some chemistry department. Overall rating grade will be there given to the NAAC. NAAC head office is there in Bangalore. And as morning I have told you, NIRF is there in New Delhi. So this is the basic information. And NAAC now the application form, what is there currently, it is not available. The NAAC application form in official website of NAAC, it is not available. And those who applied earlier, for them only visits are going on. So they would like to launch the application form in near future. The officially NAAC chairman, EC chairman, Professor Sahasra Buddhi sir, term, so I think it is completed, and new EC chairman already I heard appointed, and is also a very learned person. So earlier worked in IGNO as Nageshwar Rao sir. Under his leadership, the NAAC form may come very soon. So in this, they have started the NAAC application form as a binary application form for new, and MBGL maturity based grade level, level 1, level 2, level 3, 4, 5. And maturity based first time medical college is applying for the NAAC, you can apply for the binary. Binary application form is having 10 criterias, 11 medical college, and the level 1, 2, 3. Level 1 is foundation, level 2 is developed, and level 3 established, and the advanced and global excellence level 5. So like earlier C, B plus, B double plus, A plus. Likewise, suppose it is 3.01 to 3.25 A, 3.26 to 3.50 A plus, 3.51 to 4.0 A double plus. This is not there now. Now those application forms, they want to complete it very soon. Those who have applied under that category, new application form, NAAC will be going to launch. And moreover, as you know, that there are a lot of changes in the Education Ministry, Government of India, the all accreditations they would like to get under, and that is National Accreditation Council, all approvals except medical and other, they would like to have single umbrella higher education. The authorities, they have started Vikasit Bharat, all that. So basically, NAAC is with NEP 2020, sir, for engineering. For universities, for medical, it is different compact system. That I would like to, but criteria is same, and the application form questions, the alignment is different. That I would like to discuss with you now. And procedure, how to apply for the NAAC. First, you have to register your college name in NAAC official website. Login, register. New or earlier, the already you have institute ID, user ID, password. If you enter into that, you will have your application form. For new one, you have to register it. See, once if you open the login and if you enter the basic data in that college name and the society name and established year and email ID of your college and contact person, if you enter it to your email, you will get the user ID and password. With that, you can open a portal, and in that IIQA application form will come, institutional information quality assurance. In that one, basic your institute name and you, whether it is AICT, whether it is NMC, what is your letters approvals from NMC, last 3 years if you have got or not, last 2 batches you completed, graduated or not, and regular in these 3 years and 5 years you have got regular regulatory council approvals or not. Like this, some PhD holders data and affiliation letter you have to upload. That is IIQA submission. Then with a fees of 28,500, if you pay, SSR will be opened. SSR you have to have some, earlier it was 8 criteria for medical, now it is being in health sciences manual. NAAC manual is there. It's a health sciences manual is the bible for NAAC SSR application form, how to fill up the SSR application form. In this SSR, 2 parts will be there. One is quantitative, another one is qualitative. Quantitative is the data verification and validation. Means you will have all number game. A table will be there, faculty list. How many faculty are there? See, faculty and suppose for example PhDs. How many PhDs are there? How many are required? Based on that, the calculation will be there. And suppose you are offering certificate courses. How many certificate courses you are offering? Whether you have given all evidences for the certificate course, that means the syllabus for the certificate course and the timetable and faculty who taught and the examination that you have kept and students who have applied, who have attended attendance and overall report over that. Like this, you have to submit in online evidences, then only it will be considered. That is called as the DVV. It is a quantitative. Quantitative was around 60 to 70%, and peer team visit was around 30 to 40%, based on different colleges, universities, autonomous colleges. This will be there. So SSR is having DVV part. First, SSR you have to fill up. That is the quantitative and the questions, and which will have the SOP, standard operation procedures, and what data you have to keep, what data you are not supposed to keep. That is standard operation procedures. And next you have the questions, and you have the URL for the quantitative questions, and peer team evaluation questions are write-ups. So this is 2 types of SSR questions. And after the filling of all this, after uploading of this in your NAAC website and links, you have to give in SSR. After submission of SSR with due fees, and then you will get the first phase, DVV. DVV you have to, some deficiencies will come, you have to comply that. Again they validate. DVV third party will do, and coordinator will be there for your NAAC application form for your college. He will moderate it, and after submission of the DVV, then it will go it, and quantitative score will come, and pre-qualification will be done. Then afterwards the peer team will be appointed, 3 members. For medical college it will be 4 to 5 members, and 3 days will be there. For engineering colleges 2 days will be there. Universities also 3 days, like that, 3 to 4 days, depends on the number of programs that you are offering. So likewise the peer team visit. Peer team will evaluate the realistic things which you are teaching, learning, as well as the curriculum, but as well as the research and infrastructure and student support and governance and best practices and medical related, the clinical orientation and the patient care and the NEET admissions like that. So many things they list it, and weightage will be around 30 to 40. So put together this, you will be given the grade. Suppose you are getting 2.81, you will be given as B. Earlier, not now. Earlier it was BD double plus. Suppose you got 3.26, it will be given A double plus. 3.52 A double plus. A plus 3.26, A double plus 3.52, like that, more about to that. So like that. Now to curb this type of the challenges, NAAC has removed the grade system. Now they are offering only the level 1, 2, 3, 4 binary. Binary is very simple. If you apply medical college, if you have nearly 45% score, 90% will be in online only. That is data submission, DVV, 10% PT visit online only. You will be getting the accreditation. Basic point is that, like Geo, first he will give the SIM card free, and first he will give. See, Government of India also would like to have more number of colleges are being encouraged, and to undergo the process of quality assurance. They are encouraging 50%, 45%, 40% for a medical college. It's not a very tough thing, very easy, and moreover, if you have IQAC cell, and if you have the deans, if you put up some time, if you take advice from some of the questions where you struck, so automatically you will get very good percentage, more than 70% you will get. Say, I know, I have visited, I am in practice of this, I know very well. So every college can apply NAAC. Once this is every medical college, it gives the value to the university, as well as value to the government of Andhra Pradesh, value to the nation. If you don't know, suppose for example, one can sing well, but see, not singing on the platform where the public are there. So once if you come into the, once an application form is loaded, and you come in evaluation, where you are, you will come to know. See, somebody should, the third party should recognize you and grade you. It will be bit different than on your own if you claim. See, this is what I can say. Let's visit this part. And next, see, very interesting NAAC flow also, this SSR submission also. AQRs, after getting off the rank, you have to submit. So this is a process. See, this also I have explained to you. And the student satisfaction survey will be there. That is on curriculum and central facilities, and the student feedback and faculty, like that. See, there will be a difference in SSR of normal colleges and medical colleges and dental colleges and nursing colleges. They come under the category of health sciences manual. So health is measured in a different way. That is, the clinical orientation will be there, hospitals will be there, patient care will be there. A lot of things are to be considered in the medical. So they have given the benchmarks, and criteria are different. For example, if you take general SSR, see the teaching, progression, governance, infrastructure. Here you can say medical college SSR evaluates teaching, clinical training, hospital service, patient care. And criteria one, curricular aspects. So in engineering or universities, we have CBCS, choice-based credit system, curriculum enrichment, add-on courses. In medicine, we have CBME, and it is a compact-based, the medical this thing, and clinical competencies, and ethics, and the attitudes will be there, and early clinical exposure will be there. This is a criteria one. See, curriculum will be the base. Any regulation, if you take first, the syllabus will be there, course structure, that is the chapters, and you will have the credits and hours you take in medical, and then you will have the pedagogy, teaching, learning. Then you have the assessment. These three will be there. This curriculum, curricular aspects. So you will have like this. Then the curriculum outcomes. Now everything is outcome based education. Even NMC is giving the course outcomes. And the listed course outcomes for first year MBBS subjects, second year MBBS subjects like this are already designed and given to the and the NMC has given in their syllabus about these outcomes, outcome based curriculum, outcome based education. Outcome based education means vision, mission, POs and course outcomes and calculation of that. So these are all the outcome based. In NMC is a step forward in this, and its exercise is going on this outcome based curriculum and outcome based education in line with the global medical education, how they are importing in the other countries. How some of the teams have visited the Stanford Medical Institute, Harvard Medical Institutes. Always that the reforms are being every 2 years, 3 years, 4 years, the revision of syllabus, it will be applicable. In this, the curriculum outcomes, competency based internships, readiness, clinical rotations, and bedside teaching, skills, lab usage, logbooks. See, these are the outcomes, internships, because doctors, you call it as an interns. See, 1 year internship will be there, and the clinical rotations, bedside teaching, skills lab, logbooks. This is the data required to upload to the NAAC. See, NAAC needs lot of documentation. Every question you have to attach the documentary evidence for giving of for doing of evaluation for awarding marks. So unlike the other agencies, so more weightage is given for the online documentary, the attachment and the verification. So next one is the evaluated student teacher ratio and ward teaching, peer team checks, OPD teaching, and the operation theater and ICU. So this logbooks and competencies here in assessment methods, OSCE, OSV, mini, sex, dopes, all medical language, Viva, written exams, seminars, assessments, patient load, the patient exposure will be their case variety. All this data you should have a register, you should have signatures, you should have timetables, and as you maintain the ward, the patient details and doctor details and OPs, and all these are documentary evidence. Next one is the research index journals. Just now madam also asked this one, the PubMed and Scopus, Web of Science, Impact Factor citations in translational research, patient impact, clinical innovation, and community outcomes. See, in this, medical colleges are assessed more strictly than general colleges. See, what I heard is in the question paper of medical subjects, suppose if we take the surgery, no choice will be given to the student. All questions he has to attempt. But whereas in case of degree courses, in chemistry, physics, and management, they give choice. So likewise, the medical colleges NAAC accreditation evaluation is somewhat strict. So there will be a definite application form. Here in the funding community outreach in medical colleges, see these ICMR grants, DBT grants, DST grants, national collaborations, and rural camps, community medicine outreach, surveys, disease screening, immunization. For example, rural camp. You are conducting a rural camp. See, first you should have a circular notification that should be there in academic calendar, and you have to take approval for that the rural camp. How many students are, how many batches are going, who is the teacher, and what are the facilities that you have. See, everything is the scheme you have to submit and take approval. Like this, evidences are required. So next one is surveys, disease screening, and focus. There in ordinary, you will have the classrooms. Here in cadaver, anatomy lab, simulation, skills lab, blood bank, see trauma centers. See, you have anatomy lab. In that anatomy lab, inspection team, they verify, see how many benches you have, stretchers you have, and students are working in each table, how many students are working, and whether you have standard operation procedure, anatomy manual for that lab experiment, do you have got or not? That lab experiment record they verify, and continuous evaluation of that record also they see how you are awarding marks, and what are the NMC stated anatomy lab specifications do you have or not. All these will be verified in the inspection. And blood bank, rules for the blood bank. So these are all data metrics, total data. See the capacity of the blood bank and the sterilization, how you do. Suppose if how you will be storing the blood, what are the temperature that you are, everything is, you should have SOP for that, for collection, for storing, for utilization. For everything you should have a standard SOP. They verify the SOPs also, like NABH. So next, the accreditation system. In this, the accreditation systems, NABH, NABL, if you have weightage will be there in the NAAC, and equipment verification, calibration methods, AMC, CMC, downtime logs, biomed support. So like this, and medical colleges focus more on internships, duty rosters, clinical outcomes, and well-being. In this one, internships, see what is the internship period, how many students, and in which ward they are posted, and in every 2 weeks how they are being given the timetable and their performance reports. So everything you should have a documentation. Basically these are all duty rosters, means timetable. This sorry. So these are all basically documentation, sir. So this so this is about some of the accreditations: infection control protocol, monitoring, clinical audits, internal, external. See, audit is required because if anything lapse is there, suppose for example oxygen cylinders, if proper the verification is not there, suddenly if the oxygen cylinders exhausted in the pediatric ward, problem will come. So likewise the audit is required, and student support progression. So on these criteria, see criteria: first curriculum, then teaching learning, then research, then it is infrastructure, then it is student support progression. In the infrastructure, labs and all that I have explained. Now scholarships, placements, alumni engagement, this you know very well. Government is giving the for this internship, you are giving some remuneration for this, and so in this one, the governance and leadership, this is the sixth one. See, superintendent systems and hospital governance and clinical committees. See, a good number of clinical committees will be there, and the constitution of the committee, and the functions of the committee, and meetings of the committee, minutes of the committee, and resolutions of the committee, implementation of the committee. Every committee, you should have a documentation for this. Hospital governance, hospital administration, you can separate this thing. Hospital administration, span of control will be there. There will be the hierarchy. Who will be there? Superintendent of the hospital will be there, and RMO will be there, and the in charge, the professors, doctors will be there, and interns will be there, and PGs will be there. So system will be there in hospital governance, and definite duties manual will be there. Who has to perform what? SOP should be there. And clinical quality systems and regulatory, clinical quality, infection control, biomedical waste, ethics committee, morality review. So this is for example, biomedical waste. Biomedical waste, if it is not properly disposed of, it gives the infections to the others. And infection control, how you are doing, what are the measures that you are taking, should have SOP for that. And next one, the institutional values and best practices, how you do. See, the normal colleges are different, medical colleges different. see, in the medical college, biomedical waste management is very important. Segregation and disposal and authorization and vendor agreements. See, infection control, patient safety, bed occupancy, patient load, and clinical material, case variety, diagnostic, surgery volume, teaching hospital integration, active teaching, ecosystem, clinical governance, and documentation difference. OPD registers, IPD records, OT logs, and mortality records. These records are to be maintained, and the standard format will be there for the OPD registers. You have to follow that. IPD records standard format, OT logs standard format will be there. You have to follow the same. What is the NMC guidelines are there? Accordingly, you have to have the DVV medical colleges, hospital stats and patient records, clinical load, medical equipment, and the peer team difference. The wards, I will visit the academic plus hospital. In general colleges, only academics. But here, apart from the medical college, they also visit the hospital. And they also visit the wards. They also visit the intensive care units. They also operation theaters, blood banks, labs. So scoring difference. The higher evidence is required for the medical colleges, and live verification, on-site checks, peer team visits will be there, and hospitals will go as it is live. So they visit in live, not giving the vacation, not like that. Even the college also should run a informal day. The inspections will be there, not on holidays. So area comparison. So it is a education plus healthcare is medical, academic plus hospital is medical, student plus patient is medical, and here two parameters are there. In general colleges only student. Here student plus hospital patient. So two indexes are there here, two indicators. So clinical audit, NMC laws, and the why medical SSR is much harder. Academic quality, curriculum outcomes. The curriculum is very the you have to adhere to it. NMC curriculum, very limited scope will be there, and outcomes you have to follow, and clinical quality besides teaching skills, research system, trials, publications, patient care ecosystem, safety, ethics, quality, healthcare system, governance, and see, for example, if you take research system, trials, publications, and some of the colleges, they have research centers of specialty based clinical research organization. You do the testing of animals, and testing of the some of the medicines. We call it as the different types of the procedures, new innovations like surgeries, robotic surgery, and the knee surgeries, and all that with the research. Somewhere it is there to implement here. You have to create the facility and awareness and new features to it, because in cardiac surgery so many things have come up, and in gastric so many things have come up. And if you go to Asian gastroenterology, good number of gastroenterology doctors will be there, and it is a what is happening, everything you can see on screen, everything, total diagnosis and total treatment, total surgeries, everything. So likewise, digitalization will be also there, and key clinical focus areas, high scoring marks, research output, clinical quality, and clinical focus area, bed occupancy rate, and highest impact areas in medical college is clinical teaching very high, hospital functionality very high, student outcomes very high. Student outcomes, just now we have studied, higher education, placements, results, and their the promotions, the results pass percentage analysis also, and digital governance. What we use the softwares and infrastructure, IQAC, community health, and faculty quality, research output, quality journals, publications, and all that, and clinical focus area, competency based. So like this, there are 300 slides. I would like to discuss only few. That is, the NAAC is for 40 hours we take for medical college. So In a nutshell, I have to complete in 40 minutes. So these are the criteria. You have got highest weightage clinical indicators. This we have discussed. See where you get low scores in medical colleges. Suppose if you have low patient load, and weak research, poor documentation, no digital system, you won't get NAAC. Even C also you won't get. Weakness means suppose patients are not there. NMC also will not give recognition. So in the NAAC inspection, these are the gaps. So you should see that when you are applying, minimum number of patients as prescribed by the NMC you have to have. And the record of patients and digitalization of patient histories and case studies and the reports, discharge sheets, you should have proper maintenance of all that. See, and there is some SOP for that. For joining one type of SOP, for treatment, for diagnosis, for the discharge, there will be procedures for that, and report, everything for say, some 1280 SOPs are there for NABH, for medical college, so hospital running for that. We are doing that one. So these are the some of the things you should verify before applying this. And fastest ways to improve NAAC score and improve the research incentives and reward the index publications and research ను ప్రోత్సహించినప్పుడు and publications those who are doing, for them incentives should be given and appreciation should be given, and digital dashboards, track governance, documentation, standard records. That means data center should be there. FDP, seminars, clinical audits, run document audits, and future MBGL readiness. Actually, for level 1, 2, 3, 4, 5, medical health manual, the professors, stalwarts in the country, they have some meetings to develop this health manual for new MBGL. First binary is ready for health and other colleges, that is general colleges, engineering and universities. Binary is on today ready, but waiting for the government approval. The NAAC, according to sources in newspapers, what I read is, so they would like to launch. Binary is there for MBGL. Still, those who have got NAAC already, for them, if you would like to go for level 1, 2, 3, bit 1 or 2 months they have to wait, according to the sources in newspaper statements by the government of India. And so the practical high score application form I will show now. What NAAC peer team will see: clinical material adequacy, bed occupancy, OP strength, specialty wise patient load, teaching quality, skills lab, integrated teaching, AETCOM, and skills lab utilization, patient safety, research quality. Generally, the attached hostels will be there in the medical colleges. This is one of the marks will be there for hostel. And a hospital, as per NMC norms, hospital distance should be maintained within the campus, and that also they verify. All NMC norms are the norms of the common challenges in the NAAC accreditation. Documentation gaps. You do the things, but you won't maintain the record. That means circulars, and signatures on the circulars, and then the attendance for any workshop, seminar, and the resource person profile, and the content what is delivering, and like this a record is to be maintained and a report over it. So this is one of the inadequate data management, lack of quality culture, and faculty shortages, and delayed compliance activities, infrastructure deficiencies, research limitations. For preparing this 2-3 years before assessment cycle, strong means your accreditation will be going to be completed after 2 years only. 5 year will be given. 3rd year only you have to start. Every year AQR you have to send. Role of NAAC is it takes feedback, and hospital and medical colleges role, integration of NAAC and NABH, and outcome-based education, community engagement, sustainability green campus, key performance indicators, student pass percentage, research publications, faculty-student ratio, patient inflow statistics, placement and progression, research grants and obtained stakeholder satisfaction. Core indicators. If you have this, you will get the NAAC. Grade or level we will see later. First, student pass percentage, minimum pass percentage, publications, minimum, faculty student ratio, as per NMC norms, patient inflow, as per NMC norms, placement and progression. As you have good, you will get more marks. Research grants, stakeholder satisfaction. See, peer team presentations. This is also a big topic, how it will be, and accreditation activities and future trends in accreditation. You can see institutional preparation timeline, research improvements, infrastructure development, major quality initiatives, student support mechanisms, and accreditation outcome. So this is the application form, sir. And this, in the medical bit different will be there. As I have shown you, this is the breakup of the each criteria. Actually, earlier you have 7 criteria plus 1 criteria 8. Now, same application form is divided into 3 categories. One is input based, another one is the process based, another one is the outcome based. Input based is the number game, curriculum. A book will be there, chapters will be there, and modules will be there, and the topics you explain. So that is the curriculum, is the input based. It's an integer number game. And faculty, 10 assistant professors and 8 associate professors. Is a number game. So that's why it is an input. Process is input. And for faculty recruitment, there is a procedure of NMC guidelines, qualifications, and ratio you have to follow, and government roster you have to follow. So many things will be there. And notification, open advertisement you have to give, or some procedure. It is universally accepted you have to have. And this faculty resources, pay allowances means in the application form, peer team will verify your salary register, service record book, SR book, and your the monthly bank and TDS. See, NAAC peer team will see the faculty list and their qualifications, original certificates, and it will verify the appointment order, joining report, and TDS, and the pay scale, what they are getting, pay amount from the register. And from the audit report, they verify all faculty institute level, and Form 16. All these they verify. So likewise, for every small topic in the NAAC, you will have good number of evidences are required. So that we have to prepare. And infrastructure is also anatomy lab, biochemistry lab, like this 1, 2, 3, 4 numbers. So that's why it is a input based. And infrastructure is, and virtual augmented learning management system. So learning management system and LMS, all top colleges are maintaining LMS system, and online education, ICT, and AI systems. And financial resources means management. Financial student fees will be there. Government it is limited, but in private colleges, student fees is a big component. So AFRC will fix it. And
That to show the fees.
sir, that order they ask, AFRC order copy, they ask whether you are collecting more or less, and to that fees, what is the justification that you are giving. So and it is a perception oriented. Peer team visit is perception oriented. To that fees, you are having fees. See, for B category, you are charging 8 lakhs, but your facilities are not meeting up to that level. Means it's only to compare how you are giving facilities and quality education to the students, basically. So this is the first four. If you take curriculum, faculty, infrastructure, financial, these are the input based. Input based means numbers 1, 2, 3, 4 integers you can count. Next one is the process based. NAAC application form is of 3 categories. One is the input, second one is the process. Process means ongoing, like teaching learning is a process. You will have a method, teacher will be there, and definite content he will deal, and video tutorials will be there, and students will have the expertization of teacher will have expertization to teach the students, because see, if the quality is not there in teaching, nowadays student won't listen, because the chat GPT has come, and the DeepSeek is there. If content is not good, automatically student won't turn up. Just he will respect, but the quality that you are, so that's why the teachers day by day has become very challenging. So because the all online information is there, so that's why. See, in earlier IITs, NITs, before they used to give the topic IMs, we used to prepare and go and present here. It's instantly you can have any information from there. So teacher quality is very important. It's a process, and teachers should have facilities like earlier OHP was there. Now it is OHP not there. Now you should have LCD projectors and online facilities, the Diksha and Moodle, MOOC, and all facilities. Suppose, for example, question paper. You are giving in Moodle, and the student is writing answer in the Moodle, and teacher is collecting answer in the Moodle online evaluation, and is giving your marks in the Moodle, and like that technology is a lot platforms are there, and process oriented, and extended curricular engagements. So these technical clubs, donation domains. In medical, you have got different camps and outreach camps, and patients you will come for testing and for diagnosis and for treatment, prescription, all that. You'll be doing that. Record of it you should have, all this outreach and competitions and all that. And next one is the governance. Governance means always there should be a policy. Policy means in research, seed money policy should be there. University will give a policy, NMC will give, see, and consultancy, there should be a policy. For funding, there should be a policy. For travel grant, there should be a policy. And for research centers to the affiliated colleges, there should be a policy. Everything runs on manuals and policies. And these are framed by the governing body, and in line with the regulatory councils. You're not operational, you will be there in execution. But suppose, for example, anti-ragging committee is there in governance. Anti-ragging committee, the constitution is given by the regulatory authority. And suppose you have in the board of governors, what is the list? And suppose you have the women empowerment, that is internal complaints committee, all that, and record of it you have to maintain. In the NAAC visit, not only in NAAC, in NMC, also they are insisting on anti-ragging and grievance redressal. These have become mandatory nowadays. Ombudsman, the university, and so many cases are also there. Students with an email, they will send directly to the registrar or vice-chancellor complaint from my college. See, every day, even general university vice-chancellors, registrars are also phone on every day. Anything may come anytime. So like this, the extended curricular, then governance, then student outcome. This I have explained student outcomes. That is results pass percentage and placements average and quality placements, higher education, GRE, TOEFL, GATE, GMAT, and CAT, and the NEET, and all these ranks, LACET, whatever it is, and those who have got admissions. Higher education has got more marks than placements. See in the NAAC. And then the research outcomes. This also morning I have discussed. Research. Anybody will do for Telugulo oka మాట అంటారు పరిశోధన. There is a dana in parshodhana. Anything if you have developed, it will have value addition to you. See anything, for example, you developed a new surgical procedure. Sir, so many patients are have got relief for that. మామూలుగా సో జనరల్ earlier we used to go for open surgeries, say for a small, now we are going for the laser. So there is no wound, there is no nothing cutting, everything. So likewise, the new procedures and technology updates have come up, and this is research, out of research. Even telephone, normal iPhone 8, 10, 11, 12, Pro, 14, 16, all these, all new features and new surgeries also. So how we are doing more comfort to the patient and less expenditure to the patient, and more of accuracy in result. Once the patient used to prepare for heart surgery, many relatives used to go and wish him and send him inside the operation theater. But now it is very common. So this is what the research outcome, sustainability. This type of actually environmental audit, green audit, energy audit, and the maintenance of premises, all this greenery. These are all the things, carbon sequestration, and the self-generated power, especially solar systems you will have install, and for that the college is having own power supply. So like that, because big campuses will be there, medical colleges, they look for this. This is about the NAAC application form under process. They have not displayed the form. Its form is ready, and anytime they may display it. These are some of the questions, and within 5 minutes I will close it, sir. See, these are the actual original the questions that were there in the earlier the SSR application form. So now this is a question: percentage of full-time teachers participating in syllabus revision. How many are there? And the interdisciplinary courses, how many you have? And subject-related certificate diploma courses, add-on courses, and institution integrated cross-cutting is gender sensitivity, and number of value-added courses, and percentage of students enrolled, and the percentage of students undertaking field visits, clinical, industry, internships, research. Percentage means how many students you have, how many went for that. So students who have taken internship divided by total number of students that you have got for that batch, for that stream. So feedback on curriculum, attribute to, and provide web link. All URL upload data will be there. Sir, overall, this is the application form, sir. It is a very big application form. As a 40 periods, we take this. So just you look into the application form.
You have to keep a,
Please.
a separate data entry operator.
Sir,
You have to
lot of
engage.
data is there. Sir.
I think people should be habituated. I think that's what.
There will be separate IQAC teams working out on this, and formats are there. Tables we have to fill up. It's a big work. NAAC. Nearly 3 to 4 months actively, all teams should work
NIRF is better, sir, rather than NAC. That is
Yeah, sir. Limited questions are there in NIRF, and NAC is actually for colleges which are having good infrastructure and the good all facilities. For them it is advantage. So patients and hospital maintenance and all that. NIRF is very clever. All these things they have not taken up. Only data. Faculty data, student data, and faculty research and faculty ratio, student results pass percentage, placements, and especially outside state and within the state and scholarships. Like this, selected items are taken. This is a application form like test match. That is a one day. Is a NIRF.
Yeah,
score.
is a test match.
It's a test match. 1-1-2, 1-1.
Ranking system they are giving comparative to other colleges, sir. And this NAC is different to each college is separate. So which is better to go for ranking first or NAC first?
Sir, actually both we have to go in my point of view, because if you have strengths in NIRF, same strengths you can have in NAC.
Reproduce.
It's majority of the data, and hence NAC is a broader view, and the NIRF is a specific view. In the NAC, NIRF, all questions will be covered. All questions of NIRF will be covered in the NAC. NAC is for national ranking and regional branding and local branding. NAC. See, one Mamata Medical College is having NAC A plus. Means the website, in the website they keep some Osmania Medical College is having NIRF ranking 36. They keep in the website, and students nowadays they are looking into the website, friendly website, and based on the quality of the institution, and student is opting, rank student is opting. See, branding and all that is coming out of quality only. So this is the NAC.
Medical colleges, sir, one. Medical colleges, the main drawback compared to engineering colleges, number one is the research output. That is one thing. Number two is the publication, of course, we are meeting. Placement. Whereas in engineering colleges, placement section will be there, and medical college, we are lacking that placement section. And number four is patents. So engineering colleges, they are scoring with the patents. But whereas in medical colleges, patent is very, very rare. So these are the few differences. So I request our Honorable Vice-Chancellor to strengthen all these things in the affiliated colleges.
Definitely, sir. As you know that from this academic year onwards, we are spending almost 13 crores on the research. Both undergraduates, we have increased to 502,000 students, and also for faculty research grant also we have increased 5 lakhs a person. Earlier it was only 25 faculty members per year. Now it is 200 people. So it is altogether it is coming around 13 crores. So we are in the forefront, but it is up to the medical colleges. They should start working, and they should apply for it and get the funds from the university. So that's what. So anyhow, this is very, very important, and particularly I should thank Ravinder Reddy as enlightened. Earlier, Dr. Professor Sudheer also has come for a former registrar of SU University Tirupati, and definitely these type of things will be a continuous process. So we request Ravinder Reddy Garu, Dr. Ravinder Reddy Garu, to visit some of the colleges. Those are interested, I think, but start working. And as you know that we had a recently an NMC meeting at New Delhi. Both ranking and grading is very, very important. And the thing is, basically out of 55,000 colleges across the India, only 10,000 has got a ranking. Remaining 45,000 is CMC Vellore. I think we'll be seeing in the Times of India, the ranking of the medical. Probably it also holds good for the infrastructure facilities, the funding problems. Like when you compare the AIMS in New Delhi, 5,000 crores for a single year. See the budget for us also. So this all depends upon this one. I think some of the private medical college they can apply it. Even I think we'll start working you sir under your guidance. Both NIRF and NAAC ranking. We'll try to improve this one as our honorable secretary and also the minister and also chief minister in the line. And we are also having in Amravati Quantum Valley. I think very soon. I think the undergraduates also they should know biophysics and all. So the Pradyumna, the secretary to Honorable CM, is also asking us to include the syllabus of biophysics and bioengineering. I think in future next month on 10th, Professor Karla from New Delhi is coming, IIT professor, where biophysics importance of it, like in the phototherapy. So some of the things I think we have to make it. So this is the beginning as a part of the university. We have to improve the academic calendar and curriculum so that the youngsters, particularly I request all the postgraduates and also undergraduates, and request the principal and also the all the professors to encourage the research, start doing, keep a one person in each medical college. I think we got 38 medical colleges, sir, in Andhra Pradesh. When divided, 17 are government and 19 are private medical colleges. And I visited all the colleges except Paderu. I think we got a good infrastructure in some of the private colleges. I think we have to still improve in the established medical colleges are there, like regional wise, Kurnool, Vizag, and Guntur, Vijayawada, these Tirupati. But still, there's upcoming colleges have come. I think definitely in the future, I think we'll definitely will improve this one. So, any questions regarding the NAAC and NRA? I think within 10 minutes we'll conclude the things.
I extend a warm welcome to Ravinder Reddy Garu to visit our Maharaja Institute of Medical Sciences. For the last 1 year, we are preparing for the next. We had IQAC assessment cell, and we are bringing awareness among students and faculty members. And ranking also, we constitute a committee and we are working on that. I welcome you to visit our Maharaja Institute of Medical College in Vizianagaram, sir.
Definitely, sir. Sir, one thing I can tell you, the practical Indian Institute of Science, they got A grade in NAAC. And one university in Bangalore, they got A++. The case was some committee appointed by learned professors. They found that with expertization, they have filled the application form. Question to answer, correct. And though the data is very good, data is available, the application form, but the Indian Institute of Science have filled and submitted is not to that level originally they got. So customization of data, working on it, and collection of data, consolidation of data, refinement of data, all these are required. So simply, even in the Central University also, lot of publications are there, Hyderabad Central University. And Vice-Chancellor and Registrar will give a circular. Professors will be very busy. 1 or 2 times they have to request, and the collection should be there like this. But it is all cut-off dates. NARF will be some cut-off date. NAAC also once applied, because that's why you have to give a system. Anybody who have published a paper, he has to submit it to the registrar or dean R&D immediately, and it should be listed. And data center should be there. You need not to send NRF has come, faculty meeting, he is asked to submit his data, not like that. See, automation is very required to have the data. So manpower reduction will be, the workload will be reduced to the teachers. So if you maintain the data maintenance is very important. Suppose, for example, on FDP, one teacher has attended. See, after 1 year, if you ask where it is there, he too Sincerely, you want to search also, somewhere it is. So that's why immediately have to store the data.
Any doubts? I think
Am I audible, sir?
audible.
Coming institutes. So we need some guidance from him. So if this PowerPoints of presentation of both NIRF and the NAAC, if it can be shared to us, I think we'll go through the PPT slides. If he doesn't have any objection, we'll go through that. And so that we'll be definitely enlightened with some of the things which you have missed in this presentation, number one. And number two is we'll be very happy to host Ravindra Reddy Garu to Tirupati Balaji Medical College, and so that we can get direct inputs about how to go ahead with both NIRF ranking and NAAC accreditation. Thank you very much.
Thank you, sir.
Love to go to the Tirupati.
Yeah, we'll be happy to host him here.
Balaji Darshan
We can
also.
cover SC Medical College as well and Balaji Medical College also.
Yes.
If you don't have any objection, if your mobile number can be shared with us, I think we'll be directly interacting with you with small.
Don't worry. I'll share in the WhatsApp the groups of medical colleges and I'll share it. No problem.
Yeah, it's a very good initiative by NTR University of Health Sciences. So we really thank the administration of NTR University of Health Sciences headed by Vice-Chancellor. Thank you.
Okay. Anybody? I think if there's no questions, we'll conclude. We'll felicitate Ravinder Reddy Garu before leaving. Thank you. Thanks, sir. Thank you very much. A good initiation, sir. Thank you, Anandal. Thank you. Nice. Stop.